Hello. This video is to help educate nurses on the risk factors of falls. This is including fall prevention. This is also used to help educate nurses on how to prevent falls in the first place. Some of the objectives being covered are: what is fall prevention? Recognizing fall risk, evaluating medications, census, environment, strengths, and goals. Also, using an assessment tool to score and set up rooms to policies for the procedure. By doing this, I hope to be able to educate nurses how to recognize fall risks and be able to implement effective ways to decrease falls. Fall prevention is a variety of actions to help reduce the number of accidental falls suffered by people and individuals. Falls are one of the leading causes of fatal and non-fatal injuries for older Americans. This is reported by the National Council of Aging. But in dealing with patients as a nurse, we must maintain fall prevention of all ages and groups, not just the elderly. Because in our line of work, patients have surgeries and different things that affect their aspect, whether old, young, high, tall, or whatever ethnicity. So we must maintain fall prevention for everyone. First, as nurses, we need to recognize what the individual fall risks are so that we as a group can decrease them. When dealing with patients in a home environment, hospital, or even facility, screening is key. Has your patient had surgery or a procedure decreasing mobility? Does your patient have vision problems or issues? How is the patient's room or home set up? What is the mental status of your patient? Are assistive devices needed or even in the patient's room? And are they readily available, or do you have to go and get them? And if so, where are they? These are questions that can help in knowing some of your patient's fall risks. So in looking at these things, we are potentially evaluating the patient's medications, environment, census, strengths, and goals. Medications can pose a hazard, especially such as narcotics, or even a simple thing such as an enema. Due to, if a patient gets an enema and experiences diarrhea, that can definitely pose a slipping hazard. A variety of medications may cause effects that can mess with a patient's motor coordination, vision, and make them weak or even drowsy. In evaluating the environment, as nurses, we must be vigilant in looking around. And as mentioned earlier, maintaining a safe environment can be effective in reducing fall risks. When you're in a facility, a lot of times we decrease clutter and do different things like that, or make sure that a patient the side rails are up and different things are implemented so that the patient is safe in a room. But in other places, like in a patient's home, we have to do a self-assessment as well as individual assessments in their home to take out things such as slipping rugs or extra wires or different things that maybe pose an extra risk to your patient that they didn't even think about that was in their home. When a patient's senses are hindered, such as sight, hearing, touch, or different things are compromised, this can also lead to a fall risk. Being aware of this is helpful in the prevention of falls. Due to different ailments such as diabetes, neuropathy, especially in people's feet or fingers, this can cause them to have slippage of different objects in their hands, which can have them lose grip or even sometimes feel things in their feet. So this can cause them to even trip over things that they didn't know was there because they didn't feel it, or suffer from different ailments because they didn't know that was there. So we have to be vigilant on when our patient is decreasing in senses due to the disease process that they're having. Also, as nurses, we have to assess the patient's strength or gait and establishing real goals for health to help reinforce those fall preventions. Some patients have never been sick or had surgery, so they don't realize how weak they really are, especially when trying to get back up. Some of them have been under anesthesia, and so when they come out of different things, or even they've been the one that's been the strong one the whole time, we have to reinforce that we're there to help, and it's nothing wrong with someone else helping them, so that they know that they're not 100% and we're here to help them get there. But right now they're weak and we need to help them prevent those fall issues. To further help, facilities have placed policy, signs, wristbands, floor mats, and other actions to prevent falls. Sometimes with assessment, the higher the number, the more things are in place to reduce the risk for falls, such as in hospitals. Sometimes you'll place signs outside of the door that say if a patient is at fall risk, so that you know, even if it's your patient or if it's not a patient, if you're going in to help, that patient may need extra assistance, maybe a gait belt to get up, or may have to use the walker to get up, or bedside commode, or even a bedpan when trying to even assist them in doing other things. I also like in my facility that we use a whiteboard, and we update and try to keep that update with their progress to say what they're actually using at that time. So if they're using a walker at that time, or if they're using having to have 2 people get them up, or if we're using the mechanical lift, we try to update our whiteboard so that communication is up, so that if someone has to go into the room and assist, then we already know what level of care and help that patient needs, so that you're not asking and the patient thinks, okay, well, I can get up and do something, and they're getting up out the bed, and then their legs are wobbly or spaghetti and both of you are almost on the ground or on the ground. And that also creates a fall risk as well. So communication is also key within the healthcare community as well, and updating that board too. To further help, facilities have placed policies, decreasing clutter and also helping patients room and reorienting them. So even sometimes you have to go in and tell your patient, you just had surgery, you just came out of that anesthesia, you're not 100%, we'll get there soon, but you're not there right now. Many facilities use some type of assessment tool to help score fall risk. So anytime, you get a patient, you do that fall risk assessment. Anytime things have changed, you do another fall risk with your assessment, and that will help as well. And then this further helps the nurse in the goal of fall prevention, to put that patient fall risk and needs. Also, talking about even the fall prevention with your patients makes them aware of their fall risk. Most patients don't see themselves as a fall risk. So by talking to them about their medications, how this affects them, even in the environment, new environment or environment after the surgery, this can help them to understand why you're telling them they can't get up or they need assistance or they need help. Because some are strong-willed and stubborn, as we know in the medical field, and just by us helping, they see that as needing too much help, or they see that as taking away from their independence, which is not the case, because we're there to help. So in talking to them about how these medications and environment has changed, this explains to them the reasons for not getting up. So National Falls Prevention Awareness Day is every September on the first day of fall. As nurses, we can use this day to further promote fall prevention awareness and screening to draw attention to potential problems. So you can use this as a fun time, a fun day to create things around in your unit, to allow patients to understand this in September, to not only do this from day to day, but have September as a month to poke it out and make it just spread out just a little bit more, so that your patients as well as staff understand why we are here to prevent these falls. Because we're here to care for our patients, and we definitely don't want them injuring themselves or even harming themselves after they've had a procedure due to them falling and actually injuring themselves more to even have a fatal to non-fatal accident for something that could have been preventable. So in conclusion, fall prevention is a team effort, and establishing a prevention program tailored to the individual. As the patient changes, so should the assessment for risk of the falls. This will help in the prevention of falls and educate patients on the overall health. The more you reiterate why they need to do these things, the steps into doing it, and why we're there to take care of them, the better it will be. So I hope that all the objectives were done for you. I hope that you understand why, what actually fall prevention was. You recognize some of the fall risks. We've evaluated the medications, the environment, the census, the strengths, and the goals. And I hope you're able to recognize the fall risks, such as those medications and even surgeries or vision changes or even long-term rehabilitation methods used when patients are going through treatments, so that we can together as a team of nurses decrease falls together. And this is my video to help nurses in the prevention of falls.